So we put a bunch of time.
All right, everybody. Welcome. What a good turnout, you guys. So glad you guys can come. Starting off, just to introduce myself, I'm Angela, and I am the owner of Cancer Rehab Austin and the director of Health and Wellness at Texas Oncology. I'm a certified lymphedema therapist, oncology rehab therapist, and also do pelvic floor. And I'm so happy to have Dr. Elisabeth Potter here, who is not only one of the best plastic surgeons in Austin, but also has some real great expertise when it comes to lymphatic surgeries. So we're excited to hear about that. We have Missy, who is our compression garment expert from P&H Services. And then Adam is our compression pump specialist, who's down making sure everyone can get in the building, but he'll be back up here shortly. Before we get started, unfortunately, part of our series was our course that was going to happen next Thursday, and the dietitian is unable to make it to Austin. She's from Australia, and there were some complications. So that seminar is canceled, but she's looking into doing a webinar, and I will, if you're on our email list, you'll hear about that when it happens. So hopefully you'll be able to get this information at some point in time in the future. So I do apologize. All right, let's just get cracking. So I know a lot of you guys have seen like our basic lymphedema presentation, so that's not what this is. I'm going to give you a little bit of a background on lymphedema, but really I want people to understand what else is out there beyond complete decongestive therapy, which is the gold standard treatment. So we're going to review that, but I also want to talk about recent research and where things are going in the future. I talk fast, so slow me down if you need to, okay? All right, so the lymphatic system. The lymphatic system has two really important jobs. The very first job is it's highly integrated with your immune system. And how that works is your lymph nodes are filters that filter out toxins, and then also your lymphatic system produces white blood cells called lymphocytes that help you fight disease. So that's the first important part of your lymphatic system. The second important part of your lymphatic system is it's actually a component of your circulatory system in the sense that you always have fluid that's moving out into your tissue spaces. That fluid is bringing the nutrients that your cells may need, and then your cells are dumping whatever they don't want or don't need back into that tissue space. We're going to talk about it in a little more depth, but basically that fluid that's now hanging out in the tissues has two places it can go, your circulatory system or your lymphatic system. Oh, I'm getting ahead of myself. You have groups of lymph nodes in many different areas of the body. You have groups of lymph nodes in the armpits. Way up here, you have hundreds of lymph nodes in the head and the neck. You have lymph nodes in the pelvis. You have a few right behind the knee, and you have a lot in the abdominal region in the deep pelvis. So when it comes to GI health, that's very important, lymphatically speaking, because of the highly integrated system between your GI and your lymphatic system. Now, depending on how your lymphatic system is damaged, that will tell you which quadrant there's going to be swelling in. Okay, so if your lymphatics are damaged in the armpit for many different reasons, but the most common reason would be breast cancer treatment, then the swelling would occur in the quadrant that you've had that damage to the lymphatics. Same thing with the pelvic area. If that's where the damages to the lymphatics lie, then the swelling and the issues with lymphedema would be in the legs or the lower quadrant. Okay? So when we talk about your lymphatic system and your lymphatic fluid, it's not just what we consider, oh, I fell down, I hurt my knee, I have swelling in my knee. That's not lymphatic fluid. That's just swelling. Edema, it means swelling. Lymphedema is when the swelling is because there's a backup of lymphatic fluid. Okay? Lymphatic fluid has water, it's got protein, it's got white blood cells, it's got long-chain fatty acids, it's got a lot of bulky material in it that make it a thicker sort of substance. Which is why treating it is more unique and it takes a little bit more than just elevating and icing. So when it comes to fluid in your body, 2/3 of the fluid in your body is actually inside your cells. And then 1/3 is located outside your cells. So that, like we were saying, the tissue spaces. Now in the area where that fluid is out in the tissue spaces, 80% of that goes right into your circulatory system. It's reabsorbed right back in your blood capillaries. However, there's that 10 to 20% that has too large of items in it, like we were talking about before, proteins, cell fragments. And so your lymphatic system, those vessels open up and allow that fluid to dump in. Moves through the lymphatic system, dumps into the veins up here to be reintroduced into your venous system. So, I love this picture because we've got arteries, veins, this is where they come together, and then everything in green are our lymphatic vessels. They are like those little finger projections into the tissue. All of this around here are your tissue cells. So they're absorbing and bringing in the fluid that's just hanging out there. So how is our lymphatic system damaged? Most of the time we hear it's damaged because of cancer treatment. Our lymph nodes have either been removed for staging, or they your lymphatic vessels are damaged because of radiation treatment. So that's the most common reason that we hear about, but there are other reasons why we can acquire lymphedema or we can damage your lymphatic system. One of them is overuse of your lymphatic system. So if we have a chronic condition that causes chronic swelling, such as if we have a pulmonary issue or we have a vein issue, your lymphatic system is working 24/7 to pick up that fluid that's hanging out in your body. So over time, if that swelling is untreated, it can turn into not only swelling, but lymphedema as well. Signs of lymphedema, I bet everyone here knows that's really not the topic of our conversation, but just to make sure we're not leaving anything out. Swelling, feelings of heaviness and tightness. Restriction in motion is specifically because of the swelling. So I feel like my hand grip is really restricted because there's swelling in my hand. Aching and discomfort. Aching and discomfort can be other things too. So if you're experiencing that and unsure what's going on, definitely go to your medical doctor first to rule out anything else. Recurrent infections. They are finding that the more infections you get, the more traumatic that is to your immune system and your lymphatic system, and you do have a higher incidence of acquiring lymphedema. So ensure that when you do have an infection, you get it treated immediately, okay? Because it can spread pretty quickly if your lymphatic system is not working adequately. And then lymphedema over time, if that fluid's not moved out of the area, can become a firm type of swelling that's harder to treat. So treatment in the early stages is really important. So, lymphedema types. Secondary lymphedema. Secondary means something external has happened to your body that has damaged your lymphatics. So surgery, radiation, trauma. In some countries, there's a particular parasite that damages your lymphatic system. And then also chronic cardiopulmonary, cardiovascular issues, or obesity issues. But there is primary lymphedema. So there are some people who were born with lymphatic vessels that are too small, that are too large. They were born with not enough, they were born with too many, or different numbers of lymph nodes. And sometimes that leads to swelling immediately. Sometimes it takes time for the body just to realize that it's not able to move fluid as easily because of the issue with the actual development of the lymphatic system. So primary lymphedema can occur at any age. Prognosis. Currently there's no cure, but some of the things we're going to talk about today are really positive in the potential for the future. But we do have some treatment out there that are really effective in managing it, decreasing the swelling, and ensuring that we don't have progression. And that's what we're going to talk about today as well. So currently, the gold standard's been considered complete decongestive therapy. That's what I do. That's what any certified lymphedema therapist does. And it has these different components, which we're going to go over each one in detail. Education on skincare. Remember that we talked about how if your lymphatic system is compromised, we're at increased risk for infection. So we want to ensure that we understand signs of infection and that we do things to help reduce our risk for even getting an infection. So I'm just going to put this out here, signs of infection or redness, pain, fever. If that happens in an area where your lymphatic system's been compromised, don't wait until Monday to go to the doctor. Go to urgent care and get on antibiotics. Manual lymphatic drainage. Manual lymphatic drainage is a manual technique that a certified lymphedema therapist does, and it does many different things. First, it helps reroute fluid from the area of congestion, or the quadrant that's congested, to areas of the body where your lymphatics are not compromised and they're healthy. So we're basically rerouting and helping your body do its job more effectively. Second of all, remember how we talked about fluid becomes firm if it just sits there for an extended period of time? So manual lymphatic drainage also helps soften that firmness a bit. It also helps increase the pumping action of your lymphatics. There's this really long word called lymphangiomotoricity, and that's basically the rate that your lymphatic system pumps. And we know that manual lymph drainage, and we'll talk about how we know this in a moment, but we know that it increases that rate, and we're actually able to see that in certain studies. And then also, it helps bring fluid up and dump into the veins. Because remember, your lymphatic system is a one-way system that ultimately dumps into the veins. And then as a bonus, it has a calming effect. So for children who have issues with being hyperactive or people who have difficulty calming their minds, manual lymph drainage can be really beneficial. I know when I was learning to be a certified lymphedema therapist, practicing with my husband, he'd fall asleep every time. And then pain control as well, which can be very important for people. All right, so compression. When we talk about compression, we're not just talking about ACE bandages. ACE bandages are what we call long stretch bandages. And with long stretch bandages, they tend to be more compressive when you're not moving. That's not what we want, because your lymphatic system, the main way fluid moves through your body is by your muscles contracting and relaxing. So we want those bandages to be working really hard as you're moving, so they are working in conjunction with your muscles contracting and relaxing. So instead of ACE bandages or long stretch bandages, we use a technique with short stretch bandages. They have a very short amount of give. And so with that, and with the particular way that we bandage, it creates a pumping action, and it also helps, the more you move, the better that pumping action works. Compression, we'll get into that a lot further with Miss Missy in a moment. But basically, compression is really important to help with that muscle pump, to help move fluid, to help make sure that any gains we've made from these treatments that we're discussing doesn't return, that we maintain what we have, softening any hardening of tissues as well. And then exercise. I'm going to talk a lot about exercise, and it's very important when it comes to moving lymphatic fluid. I know that way back when, before they had a real robust amount of literature about lymphedema, they would tell people to be cautious about movement and cautious about exercise. Now that we actually have data, that's the exact opposite of what we need to be doing. The more stationary you are, the more likely you are to acquire lymphedema, but then also the likelihood that your lymphedema is going to worsen. So we need to move. We need to get that muscle pump going. Okay? So obesity and lymphedema. We do know that the higher your body mass index, the more likely you are to acquire lymphedema, but then also the worse your lymphedema will be. So, why is that? First reason is your fat cells are actually endocrine organs. They release hormones, and one of the hormones that they release actually damages your lymphatic vessels. They make your lymphatic vessels leak fluid out, and they also impair that contractibility that we were talking about from the lymphatic vessels as well. And then kind of to make matters worse, when lymphatic fluid sits and stationary and stagnant for a certain amount of time, it actually promotes more fat cell growth. So, movement, treatment, very important. And then in general, when we're obese, it's painful to move. It's harder to move. So we can talk all day long about the importance of exercise, but it can be a challenge to get that going in a way that's pain-free and in a way that's realistic. But there are ways. Okay, so again, I'm not a dietitian, so I'm just going to speak to a few studies that are pretty basic. And then hopefully someday soon we'll have that great webinar that we'll be able to access. But one study, and this one is actually pretty old, from 2007, but they took two groups of people. Actually, they took three groups of people. One was a low-calorie diet, one was a low-fat diet, and then the other was our control group. And what they found, just in a nutshell, 24 weeks on this particular diet, they found that the reduction in swelling didn't matter what diet the person was on, it just mattered that they were losing weight. So there's all of this controversy about keto and anti-inflammatory, but basically the point is, be healthy, do the diet that's right for you, and then ultimately find a good culinary lifestyle, right? It's not a diet, it's how do we want to eat on a day-to-day basis forever. But good body mass index, good weight, being active is really what you can do to help your lymphatic system. So changing your eating lifestyle. So these are just some general recommendations. This follows kind of an anti-inflammatory model. We do know that lymphedema is an inflammatory disease, so it would make sense that these recommendations would be important. And then also these also help decrease risk for recurrence, decrease risk for cancer, so are just great guidelines anyway. And I think we all know these, right? Plant-based, as much as you feel comfortable with, replacing butter with healthier oils and fats. Salt, we do know people who have lymphedema, some are more sensitive to salt intake than others when it comes to increased swelling. So you're going to have to know your own body and know how much salt you can tolerate and then how much salt will flare you up. Again, very individual. But using herbs and spices to really flavor something a little bit more than salt may be beneficial. Red meat, get it out of your diet or very minimal. Fish and poultry if you do decide to eat meat. Sugar in moderation, it is inflammatory. Alcohol, it is inflammatory. I say moderation because I don't want you guys to torture yourself. But do know that alcohol does increase your risk for recurrence. It does increase your risk for cancer. And then exercise. Love the exercise. Strongest evidence here. Lymphatic flow increases by 5 times in the first 15 minutes of aerobic exercise. Okay, so we know it increases that pumping action. It's very important. It does not increase the edema. If you do have moderate to severe lymphedema, you should be wearing a compression garment when you exercise. But it's very helpful to improve that muscle pump. If you're cautious and don't know how to progress, the general recommendation, we don't want to create any trauma to the muscles. So muscle soreness in the quadrant that you have lymphedema, you should be cautious with that. Muscle soreness creates inflammation. So if you're progressing in a way that doesn't create excessive muscle soreness, you're progressing safely and appropriately. And if you also think about it, the stronger you get, the better your muscle pump is going to be. So I never tell people that there's a limit to how much you can lift. As long as you're progressing, this general recommendation, 1 pound progression per week, is a pretty safe way to go. And if you're unsure, you can work with a lymphedema therapist, a physical therapist, a personal trainer who knows about lymphedema to help you, guide you along if you want. Basic ways to promote a healthy lymphatic system are deep breathing. The largest lymphatic vessel in your body, the I-35, is your thoracic duct, and it runs up the abdominal area. Basically brings everything up and dumps it into the veins. So by deep breathing, we're milking that thoracic duct. That's why yoga is great. Meditation is great. Exercise is great. Decreased stress helps support your immune function. I always say that and people think it's hilarious because like, how are we supposed to decrease our stress? We're all on I-35 in traffic. So just maybe changing the way you think about that. Like, ooh, I get to listen to my favorite song while I'm on I-35 instead of rah. And then staying hydrated is very important. Risk reduction. We want to do things to decrease our risk for infection. So, just be cautious if you get a scratch or wound. Keep it clean. Keep an eye on it. Try to do things to avoid that if possible. But don't freak out if it happens. Just keep an eye on the area. Watch for signs of infection. No tourniquet effect. So just make sure that everything you're wearing is loose enough to not decrease circulation and flow. And then avoid excessive redness to the skin. Because that basically means there's increased circulation, there's fluid seeping out into the tissue spaces, and then what system has to help out with that? It's your lymphatic system. So we're trying to do things to decrease the toll on the lymphatic system because the lymphatic system's already tuckered out and challenged. So one newer sort of technology that I use in the clinic that I think it was about 3 years ago I discovered at the National Lymphedema Network conference is from Finland, and it's called the Physio Touch. Not the FlexiTouch, we get confused, that's the compression pump. They sound very similar. But the Physio Touch is similar to what they use in acupuncture for cupping. However, it's a lot less aggressive and your therapist controls the amount of suction. We control in millimeters of mercury how much suction we use. So what's really amazing about this is it does lift up the skin, not aggressively, does not create redness to the skin, but lifts it up to allow for better circulation and lymphatic flow. I find the greatest impact if we do it over areas of fibrosis and scar tissue, or if we, she's like, yes, it's very helpful, or we follow the pathway of our manual lymph drainage that we're already doing that pathway, but we're just adding this. So So certain situations, this can actually be pretty beneficial.
Is that only available in the clinic?
It's available to anyone, but it's $5,000.
Well, the pumps aren't that cheap either.
I
so-
know, yeah, I know. I don't think it's covered by insurance, but it lasts a very long time. I would just recommend that you ask your therapist how to use it and get trained, and they have a video when you buy
Just
it.
like on the pump too.
Exactly. But yeah, honestly, if I had lymphedema, I would buy it if I could.
Everything
because
you
it's-
can get for your toolbox.
Truly,
Yes.
truly. All right, so I'm just gonna do two or three really quick research updates just for your information. The one we hear about the most is this new drug. This new drug, basically what they're looking at is they know that there's an inflammatory substance in the body called LTB4, and we know that it's elevated when you have lymphedema. And what happens when this is elevated is it impairs lymphatic function. So it's like this cycle. So what they're finding is that they found a particular medication that targets this, and they found that it could potentially induce lymphatic repair and reverse the disease. They are in phase 2 of this clinical trial. They are still looking for people for the trial. So, hi, guys, no problem. So on the next slide, there's information about what their inclusion criteria is, who they're really looking for at this point, and how you can contact them if you're interested. But it's very promising to have a drug that can help decrease your lymphedema. So it's called the Ultra Trial, and it's currently at Stanford with Dr. Roxon. He's the primary investigator. Again, phase 2, and generally, and you can tell me if I'm right, Dr. Potter, but there's 3 phases to a trial before the medication goes out on the market, correct, usually? And that, I don't know, and everyone always asks how long this will take, and it can take a while, right, before we get into phase 3, but hopefully sooner than later. And again, currently accepting patients, but right now they're doing it for lower extremity, secondary lymphedema, for people who are already currently getting conservative treatment, complete decongestive therapy, or have already done it. But we're assuming that will expand in the future.
You go back.
Yes, sir.
Angela, go ahead. I have one question on the note taking, same thing with me. If we sign up on your sheet and give your email, can you give us a PDF of the?
Oh, absolutely. Yeah, and I'm gonna ask all the presenters and make sure that's okay with everybody, but yeah, absolutely. Yeah, of course. Did you get it? Pretty good. All right, so now let's talk about near infrared fluorescence lymphatic imaging. Blech. This is for a person from Utusca. So this is actually UT Health Science Center where I graduated, really close to us. And she is using a particular dye that surgeons have been using for a very long time, and people have been using it diagnostically to actually visualize the lymphatics. And she's using it. They insert the dye, they use this particular imaging technique that's similar to night goggle technology, and you can actually see fluid or your lymphatic fluid move through your lymphatic vessels. And so with her, she's done multiple studies, and some of these are actually pretty old, but she found out, first of all, yes, manual lymphatic drainage absolutely does reroute fluid, which we kind of knew when we took measurements. We knew it was effective, but this study really, I mean, if you were there at the conference and we were seeing it, and we were all in tears because it's like our passion and we can see that it's like, it really works. So that was really profound. They also found that it absolutely increases that pumping action as well. This one was interesting. When I first became trained as a lymphedema therapist, they said, when you're doing manual lymph drainage, root around a scar. Don't go across the scar. There's no fluid that goes across there. Now we're finding you can work across the scar as long as it's fully healed, and the surgeon has given the thumbs up to do that, because there could potentially be some fluid that moves across the scar. It's not an absolute barrier. Now, the softer the scar is, once your surgeon gives you the okay to massage a scar, the softer it is, the more likely we're going to get better flow across. Lymphatic vessels also regenerate over time, some of them, depending on the amount of damage. So, being able to see that we do have some lymphatic fluid that moves across scars really helps our interventions. And then also just noticing that exercise does increase the pumping action through this visualization technique. We can tell it's pretty profound. So here's the future of this imaging when it comes to, and I know Dr. Potter is going to discuss how this impacts surgery for the lymphatics, but very cool from my standpoint is, as a lymphedema therapist in the future, potentially we can use this while doing manual lymph drainage on someone to figure out what is the most effective route to massage and to move fluid, because everybody's lymphatic system is different. We might take a pathway. In the way I treat, we have a general understanding of the damage of your particular system. We reroute the way we think we should. If we're not getting the effect we need, we try something else the next time. This theoretically could give us a way we actually see a map. We visualize a map. So the restriction with this is, first of all, the training is only in the UK. And then once you get the training, you have to be in a center where you have a nurse to administer the dye, you have an MD on staff, and that's not really conducive to a lot of the clinical settings for lymphedema right now at this point in time, but very exciting for the future. Okay, so the very last thing before Dr. Potter, just want to show you this image. Okay, so this is before manual lymph drainage. So this is just this person kind of at rest with that dye. And starting manual lymph drainage. So the therapist, this is a foot and a leg, and the therapist is down here in the very bottom of the toes doing manual lymph drainage, and hopefully you guys can actually see that movement. In a moment, you'll see the therapist's hand as she or he moves up, but yeah, pretty powerful. So that's that. Isn't that cool?
Wow.
All right.
So the massage is simulating the pumping action of the lymph system.
And also being very direct with it, deciding how it wants to move it. And that's why we teach patients how to do it themselves too, because that's just doing it 1 to 2 times per week. Commercial, no, is not as beneficial as you doing it every single day. All right, I'm going to leave questions for me till the very end because I want to be respectful of our other presenters' time. But hold on to those questions and I'll stay as long as we need. But let's welcome Dr. Potter.
Okay, hi everybody, I'm Elisabeth Potter. I'm just going to talk a little bit for completeness' sake about some of the surgical options for lymphedema. I think that I want to first of all state that the absolute gold standard for treating lymphedema is complete decongestive therapy. As someone who's trained at MD Anderson under one of the country's premier lymphedema surgeons, we never over exaggerated or oversold what a lymphedema surgery can do when patients came to visit us. I don't want you to get online and see miracle cures for lymphedema, and I don't want you to pay someone $40,000 or $50,000 to do a surgery for you that doesn't work well yet. Okay, so I think the primary message I want to give you is that the treatment really is still complete decongestive therapy. There are some options for surgical treatment of lymphedema. I have done them all. I have seen some improvement and some worsening of lymphedema. And even with David Chang, my mentor, he would say to a patient that only 30% of patients will see an improvement. 30% of patients will have a non-measurable but experienced improvement. And 30% of patients will get worse. It's hard to know whether that's part of the process of lymphedema because it is a progressive disease. We can't compare the rate in that specific patient of progression with surgery and without. But these are not miracles yet. Okay. So the 3 types of surgery that you will hear about are lymphovenous anastomosis, LVA. It's also called lymphoventicular bypass. That is probably today the most commonly performed microsurgery for lymphedema. It is, kind of to go back to the traffic analogy, if your lymphatic system is I-35 and there's a blockage on I-35, you can exit onto a frontage road and go around, and then perhaps re-enter further upstream. That exit is the anastomosis, or the surgical fix that we can physically perform in the OR. We see the blockage with this imaging, which we have here in Austin, actually at Seton, and mark it, then look for a vein right near there, or a venule, a tiny vein. Cut the lymphatic vessel before the blockage, sew it to a vein, and then demonstrate that dye moves through that newly formed pathway, the new anastomosis. We can see that happens. It makes complete sense that it would be a miracle cure. But we don't have the data to show that long term, those anastomoses remain open and functioning. Okay, so when I've done a lymphovenous anastomosis for a patient here in Austin, and she would fall into that category of not measurable but experienced improvement. Okay, so for me as a surgeon, that is satisfying because I want to help my patients. It's unsatisfying because I can't really explain it. Okay, so I did 9 lymphovenous anastomoses in her arm. You try to do as many as you can, and she doesn't have the sense of heaviness that she had before, but her arm is still approximately the same size. I will tell you that she had a complication after surgery. So several months later, 5 or 6 months later, she got her nails done on that side, and got an infection that, like, for me, it would be fine, but it lit all the way up her arm. You could see everywhere I had done an anastomosis, right? And I think, when I think about how tiny those anastomoses are, the fibrosis that happens after an inflammatory reaction is certainly strong enough to totally close it off. So these surgeries, especially the one I'm talking about, would fall under super microsurgery. Okay, so I do microsurgery all the time. Those vessels are 1 to 3 millimeters in size. I can see them well at a microscope. Super microsurgery, lymphatic surgery, is less than 1 millimeter. Okay, really hard to see, really hard to even move a needle correctly. Even with a robot, I've done that, and achieve something that you're confident is exactly what you wanted. It's just very difficult to visualize. So lymphovenous anastomosis makes a lot of sense, and we can see that it does work. We're not sure how long it works, and I will say that we turned a lot of patients away at MD Anderson. So for Dr. Chang, you would have to fall into a very tight category, completely within your ideal BMI, okay? Maxed out on decongestive therapy, like at your absolute best. These folks would demonstrate a year or 2 of maintaining and then have a surgery. And some have improvement, and some had worsening. I think that the next type of surgery that is offered is called a vascularized lymph node transfer. It's more common. It's technically easier to perform for the surgeon because the vessels are in the microsurgery range, not the super microsurgery range. The idea behind that is that if during cancer treatment or an infection or some other process, you have damage to a lymph node basin, not just the damage that occurs in the extremity, the arm or the leg, as a result of the process of lymphedema, but direct damage to the basin in your axilla, your groin, wherever that may be, that you could put a new packet of lymph nodes with their little home that they like as a full package, and transplant that into the injured basin. Okay.
Where do you get it? From the other part of the body?
Right. So the worst complication of that surgery is causing lymphedema, where you remove the lymph nodes.
Yep.
I know that happened right after I left MD Anderson. And Dr. Chang and Dr. Skaraki did that case, and that was the only time that they caused lymphedema in a leg, transplanting lymph nodes, but 1 is too many. there is a technique now to try to prevent that, that makes scientific sense. It's called reverse mapping. So we can map the lymph nodes with lymphoscintigraphy at the same time, like reverse map. We can see what the primary drainers of the leg are, and we can avoid them.
Don't hit those.
Right, so we inject a dye in the belly, a dye, like a color. We inject a radioactive substance in the leg, and then we go for nodes that are not hot but are blue. Okay, so they're not radioactive but they are colored. So they're working but they're not important for the leg.
So that when you remove it, you have less of an effect, less lymphedema that you're causing when you remove it.
In theory, yeah. Every time I do a deep flap surgery, I see these lymph nodes. So this week I did 6 deep flaps. You see them every time. If you remove the wrong ones, you cause a problem. I don't remove them during a deep flap. It's normal to have some lymph nodes associated with the tissue basically in a deep flap. But these specific nodes that are in your groin, located in a very specific place, there's usually 5 or 6 or 7 I can see in a little packet. If you remove the wrong ones, you can create a problem. So that surgery is more commonly performed. It's sometimes also performed in conjunction with a deep flap surgery, so we can do that all at the same time. Take lymph nodes and the flap, reconstruct, for instance, a breast and put lymph nodes into that at the same time. Again, I don't routinely offer that because I think that they were actually reverse mapping when they had the one bad outcome at Anderson. So I'm not sure that you can completely avoid it. Again, it makes sense. And we've done studies to show that once lymph nodes are transplanted, they actually create new lymphatic channels and new connections with surrounding vessels. So it can work a little bit. We just don't know that it works well enough to repeatedly do to a human being, okay? The final type of surgery, so that was lymphovenous anastomosis. Those are the highway things, the transplanting lymph nodes. And then the final one is liposuction, okay? So really important to understand this. There's a really famous surgeon in Italy who will do full body liposuction for people with lymphedema. It can actually work wonders, but the whole point is just to reduce volume of tissue. It completely destroys the remaining lymphatics. You are destined to always wear compression garments. So it gets the fluid out, and then forever you have to wear compression. Okay. So I've taken care of patients who had that surgery performed on their arm, wore compression, and then removed it for days or weeks, and then noticed an accumulation of fluid again, and then it becomes very hard to, even more hard than it was before, to do any kind of manual treatment of that area. So I doubt that any of you guys would seek out that specific treatment, knowing that information. I will tell you, you also should not have cosmetic liposuction. Okay, so no one with lymphedema should have cosmetic liposuction in that quadrant. Okay, even though it's tempting to reduce the volume that way, I've seen complications of that are really bad. Okay, so I think the other thing we should talk about is insurance. Okay, so the Women's Health and Cancer Rights Act of 1998 says that if you have, for instance, breast cancer, that your reconstruction is covered. When I've gotten one of these procedures approved, and it took like over a year to get it approved. In general, although insurance companies will say they should be covered, it is my experience that they do not cover them. Okay, that was true at Anderson. Very rarely were they covered. I think that Blue Cross Blue Shield was more open to covering. If you want them, for instance, if you want to try one of these surgeries, what I would recommend is going to see David Chang, University of Chicago, who actually has a relationship with some of the insurance carriers, and they are more likely to cover his surgery. It is still very much considered experimental. they're very expensive surgeries. So there's a surgeon in Dallas right now who's doing lymphatic surgery out of pocket, and it's about $45,000 per surgery. I just think it would be a shame to spend your money on that. I'd rather have you spend your money on really great therapy, maybe on buying one of these pumps. I mean, that makes more sense than having a surgery that's not yet, doesn't have enough data behind it. I just talked to David Chang this week about this, just to make sure that there wasn't anything new he wanted to say. You know, he does these surgeries a lot, and the way he thinks about it is this is a clinical trial scenario. If you're willing to be someone that is on the leading edge of that, and you want to accept the risks, then see someone like him. He would be the one person in the U.S. that I would say. If you're looking for dependable, predictable improvement, I would not yet have any of these surgeries performed. Have any of you guys had any of these surgeries performed? Okay. Have you heard of them?
Yes.
Yeah, okay. The other thing I will say is that, well, I think right now that where there is an incentive, where you incentivize something, you know, people will do it, and that's a lot of money. There's not that much money in any surgery. I think the incentive is inappropriate right now. Don't have that surgery performed, please. I think that we have this technology at Seton. I brought it when I came here. I got them to purchase it. It's a photodynamic eye with a noticing in green. We can use in the operating room, and they have it. It would be great if we could get it in your hands in your clinic to be able to use. You know, the risks are low. We just inject in the wet spaces and then image the arm, and that's how I locate where I want to do an anastomosis, or the leg. I think that's kind of, I just wanted, for completeness' sake, for you guys to know that the surgical options have been addressed, that actually devoted a lot of my fellowship to training in this, to do these surgeries well. I just don't think that they're ready for prime time. Maybe they will be eventually. So, perfect.
Thank you.
Okay, thank you. Adam, you're on. Oh, I'm sorry.
No fighting, ladies.
Whoever wants to go, you can.
All right, well, thanks for allowing me to join today. My name's Adam Wilde. I'm with Tactile Medical, and I'm going to talk to you guys today a little bit about a couple options for pneumatic compression devices. Has anybody here used a compression device before? 3, 4? Okay. So my company, Tactile Medical, our whole goal is to advance the standard of care for chronic diseases at home. And we were actually started by a certified lymphedema therapist back in 2000. Her husband had replacement knee surgery and developed lymphedema afterwards. So she looked around on what was out there, knew that he needed to have something to help drain on a regular basis. And since there wasn't anything there, she designed one, and that was the FlexiTouch system. Has anybody here heard of the FlexiTouch? Yeah?
I own one.
You do? Okay.
I bought it from you.
Oh, there you go. Anybody else? You as well? Okay. Nice.
I tried to, but my insurance company said no.
So insurance can be, difficult, and that's, I think, what we're seeing across the board with lymphedema therapy. Insurance, there's different parameters on what they're requiring and criteria. So that's why it's also, not just for the therapy that you get when you go and see a lymphedema therapist, but also to have them help navigate the documentation piece of that as well. As you guys know, research over the past decade has advanced quite a bit, especially with focusing on lymphedema. I know I started about 6 years ago, and I don't know how many times when I was going out and doing a demonstration with a patient, I had to explain what lymphedema was because their physician hadn't told them anything about it, and they had tried Lasix and diuretics and, taking salt out of their diet and a number of different things, some over-the-counter medications as well, and nothing had changed. If anything, they had focused on getting the water out of the swelling and leaving the protein-rich fluid behind, which caused even more fibrosity. So the nice thing is now when I go meet with patients, I'm seeing them a lot sooner. So they're more at a mild stage, and there's a lot more education being provided. So they kind of know, all right, these are the options that are available. This is going to be something that I need to manage on a long-term basis, and I know kind of what that looks like. One of those goals is to have the manual lymph drainage on a regular basis. You don't want to let that fluid build up. I've had patients before that said, look, I use my device twice a day, once in the morning, once at night. I've done that for 6 months, got everything under control, and now I just use it kind of as needed, even if the swelling isn't there, because it is all about maintenance, and controlling that on a regular basis. So there's really two different kinds of compression pumps out there. You have an advanced compression device and a basic compression device. So you were talking about insurance. When we submit a claim to insurance, they're looking at a billing code, and it's either an EO651, which is a basic pump, or an EO652, an advanced pump. Some insurance companies require that you start with a basic pump and you use that for at least 4 weeks. Show documentation, through your conservative therapy that there hasn't been any success there. Some insurances require that you do a one-time pump trial in clinic with a basic pump, to then go with an advanced. And it's not looking at what type of advanced or what type of basic, it's just the billing code that they're requiring. All right?
Adam, let me ask you a quick question.
Yes, sir.
So you touched upon something, and it raised a question. Have there been any studies on the correlation between hydration and fibrosity?
Not that I'm aware of. I'm sure there has.
We know that when you move fluid out, but the protein stays there, it brings more fluid in.
Okay.
So from a diuretic standpoint, it's ineffective, and
That's
it
what-
can
that's
actually worsen
exactly what I'm asking
lymphedema.
about, right.
Diuretics are great for other disease
Right.
processes.
But all you're going to do is get denser fluid if you just remove the...
Yeah, so
Okay.
diuretics are actually contraindicated
Yep.
for lymphedema unless
Yep.
you're using them for cardio.
And when you were talking about that, that's what triggered me. So does hydration help prevent fibrosity? Does it have an effect on fibrosity?
Well, hydration has an effect on lymphatic circulation
Right.
and lymphatic fluid. I don't know specifically because of the physiology of that specific,
Okay.
but hydration is very important.
Great question. So the difference, I would say, breaking it down to the simplest form on the two different devices out there, advanced and basic, is the fact that the advanced pump is programmable. Mr., did you say that's right with the two difference on what they're classified as? The advanced pumps are programmable. Some have a truncal component. With the basic device, it's really, as basic as it can get. It's on and start, right? That's really the differences there. Now, the FlexiTouch system is different than any other device out there because of the mechanism of action, how it works. So Angela talked with you about manual lymphatic drainage, and I'm sure you guys are aware of getting the inguinal stimulation, decongesting and working down towards the toes if you're swelling in your leg, and then back up with the proximal clearing. Or if your arm is swelling, you're working out towards the hand and then back into the proximal to clear that as well. That's exactly what the FlexiTouch system does. So being designed by a certified lymphedema therapist, the goal was to have an at-home treatment option that mimics in-clinic MLD as closely as possible. So you'll see I have a couple of garments here. With the leg piece here, each one of these individual chambers inflates one at a time for 3 seconds, and then deflates, the next one inflates. It has a proximal preparation, goes down distally, opening up the lymphatics, and then has the drainage back up proximally afterwards.
Just simulating you.
That's right. And even the timing, the 3 seconds, the rise and fall is set to mimic the lymphatic propulsion rate as well. So this is the leg piece for the FlexiTouch system. I have some brochures up here that show the truncal component as well, but I wanted to show you real quick the the basic garment. This is the leg piece. You open this up, you can see the individual chambers here. And what this does, it actually starts at the foot. This entire chamber inflates and stays inflated, and then goes to the second, inflates, stays inflated, and then the third, until the entire garment is inflated. So if you had an MLD massage before by a lymphedema therapist, this would be like having that therapist give your leg or your arm a bear hug and just squeezing it, which I'm sure none of them have ever done, right? If you're collapsing, you figure the foot piece right here is from here all the way down. If you're collapsing that, you have all of those lymphatics underneath that are just getting collapsed at the same time. And that's why you don't see as good of a reduction, especially long-term, with a basic device. In fact, what you could see is maybe a slight reduction wherever the garment is treating, but a fibrotic cuff up above wherever it stops off. Any questions on either of these? Pretty simple.
I can speak to the fact that I never ever recommend those because I've had people develop genital lymphedema from moving fluid up out of the leg because there's no compression anywhere else in the trunk, so it gets stuck there. Or breast edema when they didn't have it by moving fluid up. And also, I don't know about all of them, but they tend to have a lot more pressure than this particular pump has a lot lighter pressure that's more, that's closer to manual drainage.
Thank you.
So Adam, let me just ask a question.
Yes, sir.
You know, I'm not educated in this area. So the FlexiTouch, you have a sequential inflammation, right? Or not inflammation, but a sequential pressurization compression. And that's going to simulate the massage.
That's correct.
Okay. And so, how long do you wear this thing?
So if you were doing it's typically an hour. It's typically an hour for a full treatment.
64 minutes.
64 minutes. If you have it on increase, it's 64 minutes.
Try stick.
But you'll see here, you have the full leg and the trunk piece. So the trunk is actually like a pair of shorts.
Yep.
And I don't have the new marketing materials, but we just launched, it's the FlexiTouch Plus. And you can see, well, I'll let you guys see this afterwards, the different programs and run through here. But it's an hour a day typically. If you're doing bilateral,
Yep.
well now you can do both legs at the same time, so it's 1 hour. But this was always, with having that same MLD massager as close as you can get to in-clinic at home, this was shown to have a systemic effect as well with the truncal involvement. So if you can see that dotted line right there and right there, that divides the body into the 4 quadrants. So this is actually crossing all 4 of the quadrants. If you're swelling here in your left leg and this is what you're treating, you're actually engaging all of the other healthy lymph nodes as well. So if you only treated your left leg, you would see benefit in other parts of the body.
So even if you just wear it for 1 arm or 1 leg, it's going to get all the lymph back up to the cistern, to the big one?
That's correct.
Okay.
And this is just going over some of the data. So the FlexiTouch system is the only pneumatic compression device that is clinically proven to stimulate the lymphatic system. The only one. This here shows a few of the highlights of the different studies as far as significantly reducing fibrotic tissue, swelling, of course, increasing the lymphatic propulsion rate, increased range of motion, decreasing pain, increased quality of life, just to name a few. But I think the most impactful study that we've seen is the one that was published in JAMA at the end of 2015. What they did is they looked at a group of over 700 patients, and they looked at the day they received the FlexiTouch system and compared the 12 months right before to the 12 months directly after getting started. And then what they wanted to see is, how did that therapy impact their rates of infection and cellulitis, hospitalization, overall healthcare costs? And what they saw is patients on average had a 79% reduction in the rates of infection and cellulitis. So almost completely wiped it out. And a lot of times the patients that I'm meeting with, they have recurrent cellulitis every year. Some have antibiotics on a standing order. They just call them when they need it, which isn't a long-term goal, or plan, as you guys know. So almost completely wiped it out. This is what the healthcare companies like to see. There was a 37% reduction in healthcare costs related to the edema, which is about $11,300 per patient. And that's in 12 months.
Okay.
That's it. I've left some brochures up here with my card on the back, and it highlights some of those studies as well. So if you guys have any questions and want to schedule a time to talk, or just give me a call and ask some questions, feel free to do so.
Just keep them all and pass them on.
There we go. And this is really the last one. I was just going to show you guys, most recently, we launched our head and neck therapy. So patients with head and neck lymphedema, because we're seeing a lot more, it's internal, not external, having difficulty swallowing, breathing, talking, even sleeping. You know, one of the coolest things, we reach out to patients 30 days after they get started, and we see how they're doing. And one of the patients that we reached out to had reduced the episodes on their CPAP by almost 75%. Yes, ma'am.
Are these all covered by insurance?
So we have a great relationship with insurance companies. We work with over 700 payers across the U.S. So it depends on the insurance, but we have a patient advocacy team as well. So if that were to get denied, we would handle that appeal on your behalf, on the patient's behalf.
And I don't know Adam, I've never met him, I have a FlexiTouch, it's about 2.5 years old now, and I actually have an out-of-state doctor that I work with, that I went to see her recently, and I was talking to a FlexiTouch rep out there, and my leg garments, I've noticed the Velcro is not sticking as much, and they were popping open. They completely replaced all the leg garments, free of charge. They just sent me new ones. So, I mean, it's really, it is expensive. Don't get me wrong, I mean, even with
So
my
you paid
insurance.
for yours or insurance did?
Insurance paid for most of it. I had to pay my copay and any co-insurance I had at that point in time, which was about $1,000.
Same.
But it really, I mean, but you got, the problem that I have with it, and I'm trying to get the double leg one because it is 64 minutes that you sit there with one leg.
How often?
I'm supposed to do both legs twice a day. I don't do that. I don't have the time for that. What I usually do is I'll get up early in the morning and I'll just kind of snooze on the couch when I do one leg. So I pretty much just do one leg a day. That's what I do, and I alternate legs.
How's it working?
I can tell when I don't use it, and I'll admit I get lazy,
Yes.
and I'm like, I don't have
Or it's
time.
late, it's like I'm ready to go to bed,
I know, I
all
don't have
this.
time. You're not supposed to sleep with them, that's the other thing too, but I can tell the difference when I use them. I
Yeah.
really can tell the difference, and it's just a commitment of time along with everything else that you have to do for management, but it is really helpful. I mean, it is.
With the decrease in the proven decrease in what it's costing the hospitals and the healthcare industry, eventually it'll probably come up to where they'll want you to do that.
Oh, we're hoping.
Your percentages are rising.
We're hoping, and there's a lot of people working to help get that moving. You guys are an important piece of that as well, helping to push with that. I know with Kathy Bates being, kind of the spokesperson for it, we're seeing a lot more awareness with that. We had one Medicare denial actually overturned by that JAMA study. We're on the federal supply schedule, and the only way we're getting there is by showing a cost analysis there. And what the cost analysis reduction was, with looking at JAMA, what they're saving, what we're all saving,
It's return on investment.
Yeah, that's right.
And then what
Two
else?
questions. You have a competitor?
There's quite a few pumps out there. So.
And then the other.
There aren't any competitors that have that mechanism of action.
Okay. Why not at night?
So that's
Computerized, why not at night?
Yeah, that's news to me. Maybe they just didn't want you to sleep in it because of the hoses or whatnot, but there's a timer on there. So if you fall asleep, you can't. I think what it is don't put it on, nonstop, I guess, or 4 cycles and fall asleep type thing. But yeah, I have patients all
I
the time.
snooze in mine. I do snooze in mine, but I don't put it on and then go to sleep at night.
Yeah.
Because you've got these hoses and I can't imagine what it would be like all twisted up and.
Miserable. I mean, it's like massage. I'll totally fall asleep, but not like, I'll feel it kick off and then unplug. Because then I don't know, that looks like a different
a
material.
different one,
Mine is
yeah.
brown and it's hot.
Mhm.
Like, I mean, you're fully Velcroed in there and like, I can't wait to take it. It feels great, but I can't wait to take it off so my leg can breathe.
Mhm.
So,
Yeah, I mean, there's gonna be, oh, go ahead.
Yeah, I was gonna respond to the question about insurance.
Yes.
I have Blue Cross, Blue Shield, PPO, very good. They've never said no to me about anything. And you guys were the ones that were responding to their denial. And they help for even to
Yeah.
them.
Yes,
So
I
they
mean,
eventually approved?
No,
Oh, have
they
not.
said no. They said, oh, by the way, you can use the cheaper one. I bet we'll approve that one. There's, you know. So they wanted to spend the money for the cheap one for me to prove that it doesn't work to get there.
Yeah.
that is
Oh,
very
that's a
frustrating.
savings for us.
Yeah, so I was like, no, that does not make sense.
Mhm.
You say most of the Medicares are approved?
So Medicare Advantage and the Medicare, what is the other one? Most, I mean, it depends if it's a Medicare Advantage plan, most likely it will be. There's gonna have to be a trial in there, a basic trial, usually for one-time trial, sometimes it's a 4-week trial. But we navigate that for you. Once you guys are interested, we can look at your insurance and tell you exactly what's required, what your deductible copay is. We provide a financial hardship application, copay waiver form, patient assistance program for patients that don't have insurance and have financial hardship. So, insurance sometimes can be tough. We, fortunately enough, have an excellent team to help fight that fight if we need to.
What's the cost? Let's say that you apply, you get your insurance company engaged, they say no, they reject it. What's the cost of the Flexi?
If you wanted to get the FlexiTouch brand new, it's right at about $6,200.
Yeah, one leg, 2 legs.
That's with one leg and the trunk piece. And if we try and get this through your insurance and they say no and you want to purchase it, then we can give you the contracted rate that we would have gotten with your insurance. So
Very good, very good. Very good.
Oh yeah, I mean, as you've heard, the company, they're pretty good about helping that out.
And so they did offer me a pretty significant discount for a trade-in on my one leg toward a second leg, and I'm evaluating that right now. Because my insurance would only cover a new one every 5 years. I've only had mine for 2.5 years. So I'm like trying to decide, okay, is it worth me going ahead and doing the upgrade? Now, my cost are waiting the 2.5 years to get the 2-leg one.
On the same
And some
side.
people can't do 2 legs at the same time also. I think that's important to understand too, that there are some restrictions as to who can do 2 legs.
And just so everyone's clear, we had studies done to show that there wasn't a significant difference in treating one leg today or both legs today. So I know it's a convenience and it's, sometimes I want to know that both legs are getting treated, but they are systematically getting treated, even if you're doing one.
Is it just for your legs, or is there one for arms?
Yes, so
arms as well?
we have upper extremity,
Uh-huh.
and it's a chest, arm, and trunk. You have lower extremity, and now we do bilateral lower, and then the most recent is the head and neck.
Okay.
That shows both sides, of course, but you have one for just one arm, correct?
We do.
Okay.
And keep in mind, if you're gonna do bilateral lower extremity, definitely be speaking with your physicians and your lymphedema therapist to ensure that your body can tolerate that amount of fluid moving up. So any comorbidities you may have may make that a concern where it may be more beneficial to do one at a time.
What's the comorbidity?
Comorbidity, like if you have a heart condition, a lung condition, yeah, any other disease process that may make your body not be able to eliminate that much
Yep.
fluid that quickly.
That's why for a lot of us have to do it twice a day. They don't want you to do them back to back. They want you to have at least 4
Get right
hours in
between.
between sessions. At least that's what I was told.
This is a funny thing, Adam, because, Nancy wraps her arm, and all that gets, goes to you, Angela, for a massage. And I was telling Nancy, I said, man, they ought to invent something. It's fresh.
You're on to something.
Not kidding. I told Nancy, I said, I know they could do this, you take measurements, you have it custom fitted, and then it just does this,
Yep.
And there you have it. You guys know.
Great idea.
I think you're onto something.
What's the life expectancy?
And the
of these
64
guys?
minute does not include getting it on and off.
No.
And that's the other thing.
Oh,
And you know it's working when you have to run to the bathroom.
So the controller, there's a 2-year warranty on the controller. There's a 5-year warranty on the garments. I hadn't seen any issue where the controller actually just goes out. If it does, that's something that the company will look at, and if it's faulty, most likely they're gonna refurbish it and send it out. I don't know of any that have just gone out and were within that 2-year period, or even within the 5-year period, where they can get another one.
So if, in technology sense, right, you guys are figuring this thing out and you're doing research and you're figuring out better ways to do it, okay? So let's say that we buy Model X, right? 2 years later, you come up with Model Z, better, faster, quicker, right? Is there a trade-in, is there a value associated with that, or do you just have to start again?
There's a trade-in.
Okay.
And that's something new.
It's 50, it was for me, they quoted me 50%.
That's pretty good.
Yeah.
That's pretty good.
Yeah.
So what are the perks between what's the difference between the brown ones like we have and these green?
So great question. We redesigned the leg piece.
Curious, I haven't
How are we
opened
doing
my
on
new
time?
box yet, I'm curious if I have the old brown
Because
one.
I can have everyone come over and check it out and try it out if you want afterwards. I don't want to.
Yeah, but if we could just have Missy go
Point.
and then.
And afterwards, I can show you guys.
Yeah,
But
we
it's,
can have
we
like a show
redid
and tell.
the garments, so they're easier to get on.
Yeah,
Control it.
thank you.
To go open my box. I know, I'm
What are you
waiting.
Hey, you're excited.
I am. Well, I still have stitches in one of my legs, so I couldn't do it.
Okay, my name is Missy. I'm from P&H Services, and we are a medical equipment company in the area that focuses on mastectomy and compression garments. Angela talked a little bit about the therapy for lymphedema. About 2 weeks before you get discharged and released into the world, she's going to recommend that you get measured for your compression garments. And we want to time it out to where if we have to order it or if you require a custom garment, we make sure you get it and you try it and that it works for you before she discharges you. Sometimes this process can be overwhelming, but working with a therapist, you're already on the right trajectory to effectively manage this. And again, it's a team thing. It's all of us working together to find the product that best works for you. A lot of people, whenever they first start wearing the garments, think that this is a one-size-fits-all. Everyone's lymphedema is different, and sometimes it can be frustrating. You come in, we measure you, the garment looks perfect, but then 2 days later, your foot may swell or the top of your hand may swell. And it's just important that you communicate with your fitter so that way we can tweak it, change your garment and make sure it works for you. There's 2 different types of compression that I'm going to talk about. There's elastic compression garments and there's inelastic compression garments. Elastic compression garments have a high level of stretch. When you take them off, it regains its original shape. Elastic compression garments, they stretch out, so they typically last about 4 to 6 months. I always encourage people to date them on the tags because although it may feel tight, it does eventually wear out and those swelling will start to tend to creep in. So it's important you replace them frequently and that you know which is the oldest garment. Another thing about elastic compression is it does need to be washed daily. I had one client who wore it for about 6 months and she was like, I didn't know I could wash it. It's touching your skin directly. You do need to wash it. It is recommended that you have at least 2 on hand, 1 to wear, 1 to wash, but I always encourage you just to get 1. Make sure it works for you, then get a second set. Inelastic compression garments have limited stretch. Bandaging is classified as an inelastic compression garment. It has a higher resting pressure than it does, provides working pressure significantly higher than resting pressure. So kind of like how Angela talked about the bandaging. When you're moving around, it has that pumping action to help with that swelling. Someone may ask me, why would I go into an elastic versus elastic? If your measurements fluctuate a lot, you want to have an inelastic adjustable garment. The Velcro allows for that adjustability. So if you have a flare-up one day, you can accommodate that fluctuation. Another time I may put a person in an elastic garment is if you're prone to wounds. Sometimes the pulling on and the taking off of the stocking, if the skin is really fragile, it'll open that up again. And because the Velcro garment wraps around the skin, it's just easier on the skin until it heals up a little bit better. Another time I will put someone in an elastic is if they're homebound, if they have a caretaker, it's just an easier garment to put on. So within elastic compression garments, there's two different types of material. There's flat knit and there's circular knit. Flat knit is recommended for moderate to severe lymphedema. Another great thing about flat knit garments is if you have a shelf, over your ankle or over your knee, circular knit garments will want to collect there as opposed to flat knit garments that want to smooth out that shelf and help support it. With flat knit garments, we have a lot of options. If you have swelling on the top of your foot or swelling on the top of your hand, we can sew pockets in the garment, and I'll pass this around, to help take care of that swelling. Another common area is around the ankle bone. I like to use foam that's removable, so if it doesn't fit in a shoe one day, take it out and wear the shoes that you want to wear that day. But I'm going to go ahead and pass around the flat knit. Another thing about the flat knit weave is it's made with flat material and sewn in the back. So it only stretches two ways. So it does provide better containment as opposed to a circular knit, which I'm going to talk about in a minute. Also with the flat knit thicker material, we've talked about the fibrosis and the hardening of the skin. You and your therapist have worked so hard to soften that skin. The flat knit weave creates a massaging effect that is most appropriate for that fibrosis. So that's another great benefit of the flat knit. Circular knit compression garments are appropriate for venous disease and milder stages of lymphedema. I always describe circular knit like a rubber band. It expands in every direction. So it has a higher level of stretch in comparison to the flat knit garments. Again, if you have that moderate to severe lymphedema, a circular knit's not appropriate because you're going to continue to swell in the garment. And then I talked a little bit about if you have the shelf, if you have the fold, the material will want to collect there. And in my next slide,
Missy, can I ask you a question? You mentioned shelf. What's a shelf?
So so you can see a little bit. See
Yep.
how it almost looks like there's a rubber band around your
Yep.
wrist. It happens too at the ankle.
Okay. Okay.
And so if I were to put this person in a circular knit material, the material would just want to collect there
Yep.
and create a tourniquet effect.
Yep.
So in my perfect world, I would want to put this person in a one-piece sleeve and glove combination, and I would, just like that garment we passed around with the foam, I would put foam from here, from the base of the fingers, and extend it past the wrist to build up, to keep it from bottlenecking at that area. And I say in my perfect world because, again, it's important that you communicate with your therapist, your lifestyle. A lot of people would have a hard time taking it on and pulling it off to wash their hands, throughout the day. And I understand that. And so we can do a two-piece garment and do foam with that. And this is an example of this person had a scar on their leg. And so you can kind of see how the circular knit, because again, that material wants to collect there, it's cutting in on their leg. And that's when we would want to use a flat knit garment. And then this last picture, this is a garment, I'm a huge fan of color, but I did not tuck this person into all these colors. But this is an example, I wish I had a picture of her without her garment, because she does have a shelf at that ankle, and you can see with the garment on, you can't see that shelf, it just smooths it out. Another thing is that she had a lot of swelling on the top of her foot, and so what we did is on that toe cap, we sewed a pocket in with a piece of foam to help compress that area. Again, going back to the lifestyle, this particular person told me she had, occasionally she would have bad days where she would have a lot of accidents, bathroom issues. And so I wanted to do, instead of doing a full one piece, I wanted to give her the option, if she woke up and had a bad day, to at least put on her knee-high stockings. She doesn't have to put on the whole thing, because something is better than nothing. And this person didn't have this issue, but sometimes when you have the shelf, so the measurement changes drastically from below the knee to above the knee. If we were to do a one-piece garment, because of the weight at the top of the leg, it would want to bring that garment down. So breaking it up into different pieces helps to support and helps to keep it up. So day garments are just holding you at what your measurements are. But for some people, the swelling does creep in. And the gold standard is for you to bandage at night, but who wants to bandage for an hour plus every evening? So what they did was they created these nighttime garments. So what a lot of clients do is they'll use their pump, their FlexiTouch at night, and then they'll wear these garments to sleep in. These are therapy garments. So again, your day garments are just holding you. Your nighttime garments are actual therapy for your leg. Nighttime garments, a lot of times people will ask me, why can't I wear my day garments at night? Your day garments, the elastic garments, have the same resting pressure as working pressure. It's too high of a compression to wear at night. At night, you need a milder compression to sleep in. Another thing is if you were to wear your day garments at night, it has a tendency to slide, to maybe roll, and it could tourniquet and cause you more issues. So that's why it's recommended for you to wear the nighttime garment. Just like with the daytime garments, different options. With nighttime garments, there are two different garments that you can wear. The first one is a quilted fabric with foam fill. This garment, it's a two-piece garment. I only have a picture of the first layer because I want you to see how it's stitched. A lot of people say this is my oven mitt garment. Yes, it does look like an oven mitt, but it's stitched in a way to help redirect that swelling. And what goes over it, I'll pass this one around. What goes over it is a light compression sleeve. This gives the foam a nice hug on that skin. We want the foam to have some light compression because the foam helps to soften the fibrosis. It helps to move that fluid. And one pro is that this is a lower profile garment, believe it or not, in comparison to the one I'm going to be showing you. If your measurements fluctuate a lot, this may not be the right garment for you because it's made based on your measurements. So that would, if your measurements do fluctuate, you may want to go into a different garment.
And it can go in the washing machine.
Yes, it's awesome to wash.
So these ladies back here can.
Missy, that stitching really, you're just trying to like build in channels to move the.
Yeah, it has built-in channels to help move that.
You have one?
And then with the chip foam, it helps to soften the fibrosis. The other one I'm going to show you, it's, so again, you have that foam that goes directly against the skin, but instead of having the outer sleeve that provides compression, you have an external Velcro system that provides the compression. Different manufacturers do it different ways. One manufacturer has knee calibrated for you, so that way you know how tight to pull the straps. And then there's another manufacturer that gives you a little tool so that way you can make sure you pull it tight enough. One great thing is that, again, if you fluctuate, this may be the more appropriate garment for you. One of the negatives about it is it is bulky, and sometimes it can be difficult to wash. I washed a few of these for clients, but I had to go to like a laundromat and use an industrial size washer. And again, it's part of your lifestyle. I have some clients that look at it and they're like, absolutely not, I cannot wear that. But I mean, depending on the shape of your limb, how severe your swelling is, this may be the most appropriate garment for you because it does, the foam is so thick, it helps to, you know, build the shape of the leg to apply appropriate compression around it.
Okay, and then let me ask you this. Now, how does something like this compare to bandaging?
To bandaging, again, bandaging is the gold standard, so that is the ideal thing for you to do, but this is something comparable. And again, we want you to be compliant with it. We want you to wear something at night, and so that's why, you know, these garments are available to make it easy for you.
So these are custom and they do measure them to you, but your bandaging is custom to you at that
Right, at that very moment, gotcha.
How long do you wear these things? I mean, how many hours of the day?
So I always tell people, if you're done for the day, you're watching TV, go ahead and put them on. It's a therapy garment, and then so you can wear it as much as you want, and then you do want to sleep in it throughout the night. Also about the nighttime garments, most of them do last about 2 to 4 years. So the life of them, these are more expensive, but the life of them is longer. And then I would say the second most frequent question I get behind, are these garments hot in the summer? Which yes, they are, but it's 100 degrees outside, we're all hot. is, will my insurance cover the garments? For upper extremity, almost all commercial insurances will cover them because of the Breast Cancer Act. For lower extremity, it's a little bit different. I would say most commercial insurances cover them, but because most policies are employer-based, self-funded, sometimes an employer will pick a plan where there is no coverage for lower extremity. But it's just important that you have whoever does your garments verify your insurance, and we will be able to tell you, yes, it's covered, no, it's not covered. And sometimes insurances require us to get authorization ahead of time. As of right now, for lymphedema, Medicare will not cover these garments. There is legislation trying to get passed. Medicare only covers lower extremity, certain garments lower extremity, if you have an open wound, because they consider it treatment. They don't pay for preventative, which is what they consider the swelling to be. So again, I mean, I think eventually it will get passed, but as of right now, it's not. But for those of you on Medicare, don't be discouraged. If you have a true secondary, a lot of times they will pick up if Medicare doesn't. So whoever you get the garments from, just communicate to them that you have a secondary plan. And then the last thing I just want to say is don't let this bring you down. I think compression garments can be fashionable. If you come to me, I push color and black on everyone. I just think, you know, it looks sporty, it looks fashionable and classy, and I love, you know, hearing from clients, you know, what they wear with their garments. You know, they wear skirts, it looks like tights, or it looks like part of their shirt. And there's a great community out there. I know a lot of people have joined, I think it's like Austin Lymphies, and everyone that I know is a part of it is so amazing, and it's just really important to reach out to the community to help you, you know, to support you in this. And that's it. Thank you.
I'm just going to put on here the website for the Lymphedema Treatment Act, and anyone who has lymphedema, treats lymphedema, knows anyone who has it, needs to go onto this site, and just, it gives you a simple cut and paste to send to our legislators to get this act passed. We've been trying to get this act passed forever, but basically to ensure that you guys get any treatment you need for lymphedema covered, including compression garments. So we're getting closer every year.
I have a question for Missy. This has become a recent question. Will DEET harm the elasticity?
That is a great question that I will find out for you and call you. I haven't had that asked to me yet.
It's the time of year.
What's this Austin Lymphies group? Because when I went to the website, like, they never wrote me back. Several of us have made our own Facebook group.
Is anyone here, I thought it was called Austin Lymphies.
It's actually a Facebook Messenger.
Oh, okay. Well, when I first started working with my therapist, she said there was actually a website, and I hunted high and low. I'm Lauren. I'm on your Facebook Messenger.
I am Doreen.
I think that one has no more.
Okay, that's what I thought, because there was like a phone number, and they had recurring meetings, and like it was non-existent. But yes, if anybody wants, we have a ongoing Facebook Messenger to catch in, and we try to do lunch once a month.
Yeah.
And my long-term vision is to have a support group regularly, so. All right, so let's have all of our presenters sit up here, and we're here for you with any questions you may have.
Just got one of those.
And then I know someone's gonna try on the pump, if anyone wants to watch.
Explain the swell spots, how that.
So it's that chipped bone with light compression over it, the same as the nighttime garment. They make them from all different parts of your body, for your breasts, for your groin, for your neck. And yeah, I mean, they're amazing. They do work. They have where this chipped bone helps to soften that fibrosis.
That's what it's okay.
And I have a sample for you.
Oh, I've got some. I just want to know what they're doing. I think I've got one of everything.
It's no injury, so no matter how long you need to take it off. So like they really want to help you, like, yeah, so.
Have some snacks.
I know it's expensive on the top of already an expensive, issue, but
Oh, and I just
I
want
feel like that's a good
to let you guys
list.
know about our upcoming seminars, and we also have free exercise classes for cancer survivors, thrivers, and their caregivers. So yeah, take our materials, exercise, enjoy our future seminars.
Thank you.
Absolutely.
Thank you.
Thank you. Oh, thank you so
Some of these were like some colors and pictures. It's like, I see their beautiful artwork and I'm jealous because I just get the colors. I get walkers and she like pulled her hand leg up and we're like, we're twins. Like that was about it. Lots of things. I know, I like that. To get me twins like spread awareness. We're like, this night, I think it did hard. No, I mean, not just something I wrote. It was all I was thinking is the teacher. And I said, I'll say something out here. I'm not hyped with. And I was like, I just said it. And I didn't want to go over it. I just said, it helps with my swelling. He turned his color. He was like, I never know about me. See, I call that my love practice.
every night.
Yes, I get that one all the time. They're scary. So like breast cancer, were you able to explain that this well, I know like several women that I've met, they're like, we were not told anything.
And there's a worksheet there that has all of our
Those, yeah.
It's just like the behind there was like a little section on it.
Yeah.
That was very
Yeah.
Yeah, and then second, oh, she did it, she used to do, so I kind of like, you just kind of together.
Yeah. What's my priority right now?
Actually, here.
And I had, sex
One of the girls on that campus actually does that. She's like,
Which is exercising definitely.
Yeah.
What's
exactly here? I'm in the primary group. I have my
you could just like move your stomach and go down.
Other than that,
Because they make you
Oh, you're fine, you're fine.
she's like, just one more. I'm like, when I'm is this gonna be embarrassing?
She's just gonna
We are like on Facebook, just like a group chat. Y'all aren't on Facebook.
Oh, okay, sure.
I can share it that way.
So it's right.
Yeah, no problem. I know I had this myself too. No support. I don't have family here. That woman has been insane. But I have found my extended family on Facebook. After I got diagnosed, I don't buy this therapist, I went up her list of just to look at this. I don't know what you want me to do, and I'm like, so the only thing I said, well, I know that, I love insurance more than I'm private. And I was like, I know I now have higher conservative treatment for I'm not going to give up what I love. Will you at least work me on straight along? She's like, what am I going to do? Anything else? She sent me to podiatrist. She was like, so now I just call my therapist and I have flare-up. And yeah, I worked with her for 3 months to kind of get my duties and then live in these beautiful flatbeds. So I know I was like nervous though because everyone's like, I know it's and I was like, already degrees, so let's go to I'm just going to have to get out in August. The only thing I was thinking
And I want like you well, one of our basic improvements, we were going to have all the CH lymphatic, we were going to like bring it all and then roll acid wash, and then like roll back up. She's like,
she's like, I'd like to get something with sugar.
Here's one